Sawadee Krap, I'm JP Mestanza. It's January 11th. Welcome to Phuket Extra, brought to you by... Over the weekend, Thailand surpassed 10,000 COVID-19 cases. But still, it's been a week since new COVID cases were reported in 20 provinces in Thailand, according to the Public Health Ministry. The chief of the Health Ministry, or the Director General of the Health Ministry, is optimistic that if the country continues with current prevention measures, Thailand can be near the end of the second wave outbreak of COVID-19 by the end of this month. Here in Phuket, the order has now been issued, and starting today, all arrivals from the 28 red zone provinces to Phuket will face mandatory 2-week quarantine. In addition, there is mandatory COVID swab tests for people arriving specifically from 8 highest risk provinces, including Bangkok, Nonthaburi, Nakhon Pathom, and Chonburi. It's unclear if this also includes people who are currently in quarantine after arriving from international destinations. For all of Thailand, officials are advising people to refrain from traveling between the provinces until January 31st, especially to any of the 28 red zone provinces. In fact, people from 5 provinces of Samut Sakhon, Rayong, Chonburi, Chanthaburi, and Trat are being told to have official documents stating their reason to travel, signed by local village chiefs and police stations. As the COVID pandemic has ravaged the economy, today the tourism minister proposed a plan that would allow all international arrivals to spend 2-week quarantine in some of the country's golf resorts. It's subject to cabinet approval. For more, visit thephuketnews.com. Phuket hospitals and all over Thailand, they're facing a blood supply shortage, and now the Phuket Regional Blood Center is calling for Thais and foreigners to donate to replenish the blood stocks. According to the Thai Red Cross Society, no more than 340 hospitals in Thailand lack sufficient blood reserves. The Thai Red Cross cannot provide enough blood to meet the demand, as regular donors have been coming in less often than usual due to the pandemic. The daily demand requires 2,200 units, but the Thai Red Cross is only able to provide 700 to 900 units of blood a day. The schedule and locations on where to donate are now on your screen, with the full list on thephuketnews.com. Link in the description. All donors are required to report their travel history before donating blood, and donors must wear a plastic sleeve on their arm before putting their arms into a blood pressure monitor as part of the process. For more, visit thephuketnews.com. Over the weekend, news broke of more illegal gambling dens being raided in Bangkok and Pattaya, respectively, amid a crackdown on suspected gambling venues across the country, part of ongoing efforts to contain the COVID crisis. But now the public health minister is asking, should the government pay for the gamblers' medical treatment if they're found infected? On Saturday, news broke of more gambling dens being busted in various parts of Bangkok, in which 22 people were arrested. On Friday, 21 people were arrested, including 16 foreigners, during a raid at an illegal gambling den at a Pattaya condo. Over the last few weeks, illegal gambling dens were found to be the source of outbreaks in Chonburi, Rayong, and Chanthaburi provinces, and the police chiefs of all 3 were transferred amid investigations into how those gambling dens were allowed to operate. Even in Bangkok at the end of December, authorities arrested 89 in one single raid in the Changwantana district there. Public Health Minister Anutin Chanvirakul on Saturday alluded to ending free medical treatment for anyone infected with COVID-19 who had exposed the public and broke the law. He posted this on his Facebook page, quote, "The money that is supposed to be spent to provide medical care to the public will be used to look after those who break the laws, and who knows for how long and how much, and for how long other people will lose their income and opportunities." He went on to say, "So the question is, should the government pay for treatment of the lawbreakers, or it should pay and send the bills to those responsible for bringing in new patients?" For more, visit thephuketnews.com. Phuket Extra, will be right back after this. Welcome back to Phuket Extra. A former president of the Patong Taxi Club has been arrested in a raid that netted 122,000 methamphetamine yaba pills and 2 illegal firearms. The 54-year-old Thai resident of Widget here in Phuket was picked up by police on Thursday, although Patong police did not specify where he was arrested. He was arrested, though, in a joint raid by local and provincial police from Phang province. They allegedly found Chachawan Guachan, found him with 122,000 pills of yaba, a Remington shotgun, and a .45 caliber handgun. He was picked up in a case that also saw the arrests of 3 others. Chachawan now faces several charges. For more on this, visit thephuket.news.com. Thailand today has 249 coronavirus cases, according to officials. The majority of cases are local infections scattered across several provinces, with the most in Samut Sakhon, 37 infections, followed by 36 in Bangkok and 31 in Nonthaburi. In addition, 200 naval officers have been quarantined in Chonburi after 2 positive COVID-19 cases at the Sattahip naval base in the province. With cases over the weekend, the new total rises to 10,547 for the country. 53% of total patients have recovered. The death toll is unchanged at 67. Thanks for joining us at Phuket Extra today, brought to you by the lyrics below. We'll be back tomorrow. Until then, stay classy, Phuket.